Hello, and thank you for listening to the NYCEFT Podcast. I'm your host, Jeff Fine, certified emotionally focused therapist, supervisor candidate, and director of public outreach on the NYCEFT board. Whether you're a professional looking to deepen your knowledge of emotionally focused therapy, in a relationship and want to strengthen and repair your bond with your partner, or just want to stay connected with what's happening in the NYCEFT community, there'll be something of interest to you in this podcast. I'm really excited to share with you my conversations with guests that include EFT trainers and supervisors and other professionals from around the world. So be ready to learn something new. Welcome to the NYCEFT Podcast. I'm your host, Jeff Fine, supervisor candidate, certified emotionally focused therapist, and director of public outreach on the board of NYCEFT. And we are here today with Wendy Tomkiel. Hi, Wendy.
Hi, Jeff.
Today, Wendy, we're going to really dive in and talk about how to start a session. And we're going to talk about not so much a didactic learning piece here, but the language, the words that therapists can use in terms of how to start the very first session you have with a couple, how to start the very first individual session. And there's a bunch of different first sessions we're going to go over. And I'm so excited to have you here because, you've been a great mentor to me, and I know how much you know and how experienced you are. And I think people are in for a real treat to be able to learn from you today. So before we get going, do you want to just introduce yourself, and is there anything you want listeners to know about your background?
Well, first, thank you, Jeff. I'm really happy to be here, and I really appreciate what you're doing and what you're doing for NYCEFT and for our EFT community. So thank you for that.
Yeah, thank you. Thank you very much.
I'm an EFT therapist and supervisor, and I'm a founding member of NYCEFT. So this community is certainly very, very important to me. I also have trained initially at the Ackerman Institute. It was my first exposure to couples therapy, and I worked for many years in the foster care system, which is my real first exposure to attachment and disrupted attachment in terms of professionally. It was thrown right in there without any training about attachment theory and working with families that were so torn apart. And when I did my EFT externship in 2008 with Sue Johnson here in New York, I was totally hooked on EFT and went back and thinking about if only I had that information right at the beginning of my career. And then since then, I've also been involved in some other experiential psychotherapies, including ADP and ISTDP, and have done advanced training in them as well. So all of that really does inform my work today.
Great. And you're in private practice here in New York, right? You have an office.
Yeah, I still have an office in Midtown Manhattan, right. Whereas many of us have changed our locations over the last couple of years since COVID. But I see individuals and couples, adults in and families to some extent too. And still I'm working primarily on Zoom, but still have my office in Midtown.
Great, and we'll post in the in links when the episode is posted how people can find you. Okay. Yeah, great. So first sessions, Wendy, how to begin them. It's like we learn a lot in the trainings about the assessment process. But here's an opportunity to really talk about the words, the language that we can use to begin these sessions. Mm-hmm. So I thought that we would start with the very first session, when an EFT therapist sits down with a couple, that first minute.
Yeah, it's so important.
So important. And I know for myself, even having done this for a while, sometimes I still wonder, how am I going to begin this session? What is the thing that I say? Do we start explaining the model, the process? Do we ask them if they have any questions for us? Like, what is that opening line? How do we begin?
Yeah, so a lot of thoughts come to my mind. I think that before we even think about like exactly what is the thing to say, like what comes out of the therapist's mouth, because I think some of that is going to be a bit of the art of the work. I kind of want to just think about for a moment, like why that matters. You know, what the headspace is for the therapist during the first minute of the first session or the first contact even, which is the first stage in EFT is about creating a safe alliance, right? That we're doing that always. And I think most therapies are doing that, right? In most psychotherapy, the safe alliance and the relationship is the most important factor of the therapy. But I think in EFT is really special in the way that we think about that and we work with that. And that I think it's the first step because it's such an important step. And it's something we're thinking about always. So creating that safe alliance is what we're looking to do from the very beginning. And when we think about coming together with our couples, we know that they're having an experience in the beginning, and everything they're bringing to the room is there already. So any previous experience they have with longing, with need, with attachment, with relying on somebody, with needing help from somebody, whether they're seeing, you know, how they see a medical community, a helping professional, even somebody potentially in the role of an authority figure, because in a way they're coming to us for help. We're the one that they're paying. We're the one that's saying, here's how I do what I do. You know, they're coming to us for a need. So there is a potential setup for putting us in a position of authority. And when I think about I don't know if Sue Johnson still talks about this in when she teaches EFT, but in my externship, one of the things she said was in her early days, she noticed that the patients were sitting down in the chair and the therapist came out to introduce themselves and say like, hello. And the therapist was standing up and the patient sitting down and the therapist says, hi, I'm Dr. So-and-so. And Sue said she didn't do that. What she did was she came right up to the people that were sitting in the chairs and she squatted herself down and she looked at them eye level and said, hi, I'm Sue. And it was a way of saying, I'm here with you. We're like this together we're human beings coming together with equal worth and value. That's how I see it. And that's what she's communicating to them. And I think it's trying to take people out of that position of like somebody's above somebody else or we're not all human. I think she even used the metaphor of like, we're all turkeys in the same turkey soup. Right. And I think that's kind of how you try to communicate that with somebody, knowing that they're informed by their own attachments, their longings and desires, their cultural background, their own experiences, that's all coming together. So I'm having that frame in my mind as I'm sitting down for the first session, the first minute, the first contact.
So what I appreciate about what you're saying is, as the therapist, we're thinking right away, how are we going to create an alliance? How are we going to create safety? And that might be in the very first phone call, how we, in the days when a lot of us were seeing people in person, how we walk out and greet somebody. Mm-hmm. And let's assume we've gotten them into the office or onto the Zoom call, and now we're sitting with them. We introduced ourselves and they're looking at us, and And we're looking at them, and what are the words that we start with? How do we begin?
Yeah, so we're saying hi. I mean, I guess it's also a little bit different if they're coming into our office or if they're coming into Zoom, but we're saying hello. We're saying, I appreciate the risk that you're taking to be here today. I know that there is, there's a lot of trust that you're putting in me, and I see that, and I appreciate that. So somehow that we're communicating that to them, that we see that what they're doing is a really big thing, and that their relationship is really important, and that I get that.
So some validation at the beginning, just explicit validation. However, some of this is personal style and how it comes across, but some validation, just to recognize the courage they're showing to be here together. We're assuming something is really difficult for them, and they're still showing up, and good for them, right?
Yeah.
Okay.
Yeah. And then I'm going to also socially locate. I'm going to give a little bit of just briefly how I identify. So that might sound like, hi, it's nice to meet you. I'm Wendy Tomkiel. I'm a white, Jewish, cisgender, heterosexual woman. I might offer a little bit of more information, like I'm married and I have two teenage children and a dog and a cat. And I might also then say something like, I'm going to be asking you guys a lot of questions. I'm going to be getting to know you. And I'm wondering, as we're getting started today, is there anything that you're sitting with that you're curious about me that would make this experience more helpful to you? And sometimes people will say, no, whoever referred me told me what I needed to know, or, from our brief encounter already, we got that. But some people might wonder, they might say, what experience do you have helping people with this particular issue? Or how long have you been doing this? Or one thing I've heard people say is like, have you ever been successful with helping couples with this, with this issue?
How would you answer that? How would you answer that?
Yeah, I will answer it very briefly and very honestly. So yeah. And sometimes in the beginning, like for new therapists, that can be stressful. In the beginning with me, I feel like one of the things people would have said, I don't really hear this anymore, but you look very young. How long have you been doing this? Which could be very anxiety provoking. But being able to just be honest about what your experience has been, if that's something they're wondering, and then just how they're feeling about it. Because they're sitting with this worry, and if they're sitting with their anxiety, then they're not feeling right. In order to keep people in the present moment, and to keep people connected with you in the present experience, we need them to feel a sense of safety. Right. And if they're not feeling that safety, then they're going to be activating their fight flight.
Right. And so I ask, like, have you been successful? Presumably they're wanting to know, can you help us? Yeah. And so what are the words you would use to respond to that?
I think I'd say something like, well, depending on I would answer them as honestly. Yeah, I'd be honest. So yes, I've had some success, and some of it I might also ask about, like, it depends on what once we establish what our goals are, then I'll be more informed to be able to let you know if this is something and what success means to you. Sometimes couples have different ideas of what's successful for them. So that's actually going to be one of my next questions, is going to be, what will be the outcome of our therapy if it's successful for you?
Right. So maybe the therapist might say, that's a great question. I really appreciate the question. I'll be better able to answer it when I know what your goals are, so we can have a sense of what success looks like.
Right.
What that would look like when we get there.
Right.
Okay.
Yeah. So that might be, but then sometimes people are saying, like, have you ever worked with couples where there's been an affair? We are in that state. Or have you ever worked with couples where, one of us has been diagnosed with an illness? Have you ever worked with this illness before? Or have you, I had somebody once ask me, I identified, and he said, he's a gay man, and is there any, is that something, he wanted more information about my experience working with people that weren't, heterosexual. And yeah, I was able to answer honestly, and, how is that for him that I'm a heterosexual woman? And what he said was like, he just needed to know I was an ally. That was how he described it. And then, so sometimes people are pretty clear about the thing that they're looking for, that they want to know. And sometimes we just need, more information about what their needs are. But really what we're looking to do in that moment, right, is be able to create more of that safety for them, so that they're in the hands of somebody that can care, is going to be able to take care of them. Right. It's going to be able to connect with them. It's going to be able to help them. And that might be something I might just have to kind of put out there. Like, are you worried about this? As you're getting to know me, that really makes sense. And some of this is going to, we have an assessment, and that's also an opportunity to move into, this is an assessment process. We have a period of assessment where you're going to be able to find out a little bit more about me and my style, and I'm going to find out about you and your needs, and we're going to be able to come up with a treatment plan together. So some of that we're going to be able to see over the course of the next few sessions. And then I'm going to provide some information about our structure and the structure.
What would you tell them? What information, what's the language you would use around the assessment process? In that very first session, we're probably maybe 5 minutes in right now.
Yeah, right. So this is an assessment period. This is a chance for me to get to know you, for you to get to know my style, for me to find out what is going on and be able to put together a treatment plan that we can all agree on, and know that we can work together on the issues that you're presenting. And the way that we're going to do this is today we're going to be having a session together soon, maybe next time, maybe a time after, depending on how today goes and scheduling. I'm going to be scheduling individual sessions with each of you. And during those sessions, it's going to be a chance for me to get to know each of you a little bit better when your partner is not right in the room, so that you don't have to worry about how you're communicating information, how you're sounding. It's a chance for me to get some family background, and it's a chance for you to get to know me a little bit more too, and how I work, how we can continue to build our alliance. And then after that, those individual sessions, we're going to come back together for a feedback session. And at that point, I'm going to be able to give you my assessment as to what I'm seeing, what I see as our treatment plan and my strategy for working together with you. And it will be setting up the course of our work.
That's great. And when you sit down with each partner for the individual session, how do you open those sessions?
So I'm going to open those sessions with a similar structure as I'm working, right? Always thinking about keeping in mind that alliance and that safety. So I'm going to create some safety and boundaries in that right at the beginning. This is an opportunity for us to meet together, as I mentioned in our first session. I'm going to be asking you, I do have some particular questions that I'm going to be asking you that I would like to find out about you in this session. And then this is going to also be an opportunity for you to let me know things that you think that would be very important for me to know as we're working together. Also, if there are any questions that you have for me, this is an opportunity for you to let me know. And then I'm gonna mention something about my policy on the purpose. Like, the purpose of this session is not about me holding any secrets. And I will mention a little bit about what I mean by that. So
I want to say a little, that's different therapists have different ideas about holding the secret.
Yeah. So for me, it's all about safety. So what I'm going to say to them is that even though we're meeting individually, and we might do this from time to time in our work together, the safety of your partner is always still essential to me. So anything that comes out of this session that will end up preventing me from providing a safe space for your partner is not something that is a secret that I'd be able to hold. So, and I will even give an example, like an extreme example. Like I'll say something like, you know, like if you have a secret family, you have another partner and another home and another family and another life, and you're very happy with that life, and you're not ever going to want to ever mention and do anything different about it. And your partner would be absolutely devastated if they knew about that and they knew that I knew about that, then that's not something to let me know about. Because if I found out about it, what I would have to say is, we're not going to be, you know, we'd have to figure out a plan of not being able to work together. Unless, but I would say, like, if there is something that you feel like it is necessary for us to talk about at some point, even if you don't want to bring it up in our next session, that's okay for you to put it out here. And it's something that I can help you be, you know, we can figure out how to bring that back, and what support you might need from me in order to talk about it. If it's something that's like in the history and it's not something that is going to prevent the partner's safety, then it's okay. You know, that's just something that don't worry about it. If it comes out in your history and I find out something that they don't really want their partner to hear about, but it's not something that affects them or will affect their safety in the room, then that's okay.
And it might be helpful in those individual sessions, if something like that comes up, to try to find out what are some of the client's concerns about sharing it, what do they envision would happen, and how their partner would react, and is that something that maybe you could help them with if they do want to share it, but they're sort of scared about the impact of sharing it. That might be another aspect of how we could help them in the individual session.
Absolutely. Yeah. And that might mean we have to have more than one individual session. That might mean we set up the treatment that we're going to have individual sessions more frequently initially, because there is something that that we just need to process that a little bit more to help them do that. But I don't want anything to come out of an individual session where it puts me in a position where the partner is not going to be feeling safe any longer, and I've just agreed to keep some secret. Then, you know, it's going to be a situation where that partner is going to have to say, I don't want to work with her.
Okay.
I'll put it on them to say, like, this is, you know, if they said to me, like, yeah, I have this big secret and now I told you, and I'll never want my partner to know about it, but I just wanted to get off my chest. So now you and I share this secret that, you know, I can't create safety in the room now. This person is not safe. I can't in good faith say, like, you're safe to drop down into vulnerable places that you never want to, but trust me, I'm holding you here because one, I know that they're really not safe to do that. It's like a betrayal, I think.
Right.
And I don't want to be in that spot. So,
right. Okay.
Yeah.
Yeah.